Let's dive right in. We're going to be talking about a really critical debate that's happening right now in the world of surgery. It's a story where this powerful new technology is kind of clashing with a ghost from the past. And it all boils down to one fundamental question. Are we about to make the exact same mistake all over again? It all kicks off with this. I mean, what a title, right? Back in 1993, a leading neurosurgeon, Dr. James T. Robertson, published this editorial in a major journal, and it absolutely sent shockwaves through the medical community. The title was designed to be a wake-up call, and, well, it worked. And that really brings us to the heart of the matter today. Here we are, over 30 years later, with this revolutionary new surgical technology right at our fingertips, and a lot of people are getting worried. They're warning that we're falling into the very same trap Dr. Robertson warned us about all those years ago. So, to really get what's happening now, we've got to go back. We need to understand the warning that started this whole conversation in the first place. Robertson didn't pull any punches. He basically called out his own profession. He argued that the huge explosion in complex spine surgeries, the ones that install all kinds of metal rods and screws, wasn't really about what was best for patients. He said it was being driven by money, by competition between doctors, and by straight-up marketing. To wrap your head around this, you just need to understand the two basic options on the table. On one side, you've got something called a decompression. Think of it like a plumber clearing a blocked pipe. The surgeon just goes in and removes whatever is pressing on a nerve to relieve the pain. Crucially, the spine's structure and motion stay the same. But on the other side, you have fusion. And that's more like welding two joints together. It permanently connects vertebrae to stop them from moving. It is a much, much bigger deal. And here's the thing. Robertson's warning? It turned out to be more like a prophecy. In the decade that followed his article, the data is just stunning. Spinal fusion procedures skyrocketed by 137%. Now, compare that to other common surgeries like hip replacements. That kind of growth suggests that something other than just patient need was pushing that trend. But then a new hero kind of enters the scene, a technology that promised to change everything and solve the problems of those big invasive surgeries of the past. And we are talking about endoscopic spine surgery, or ESS for short. The whole concept is just incredible. You're performing these operations that used to require a huge incision, but now you're doing it all through a tiny port, like the size of a keyhole, and you're guided by a high-definition camera. It's really the peak of minimally invasive surgery. And the promised benefits were just a domino effect. I mean, a smaller incision means you're not cutting through all those major muscles and ligaments. And if you can preserve those, you preserve the spine's natural stability. And that leads to less pain and a way, way faster recovery. It honestly seems like the perfect solution. Okay, but here's where the story gets really interesting. At the exact same time this amazing new tool is showing up, the actual science of spine surgery was getting a major shakeup, challenging a belief that had been surgical dogma for a generation. The battleground for this whole debate is a really common condition, with a bit of a mouthful of a name: degenerative spondylolisthesis. All that means is that one of the bones in your lower back has slipped a little bit forward, and that can pinch nerves and cause a whole lot of pain. Now, for 30 years, literally 3 decades, the rule was simple. If a patient had this condition, you fuse the spine, period. It was dogma. Then this massive, really high-quality study called the NORDSTEN-DS trial came along and just completely flipped the script. The findings, which came out in 2021 and were confirmed again in 2024, showed that for many patients, just doing the simple decompression, clearing out the pipe, was just as effective as that major fusion surgery. And a big difference? The thing that justified all those fusions for all those years? It was just 3.4 points on a 100-point disability scale. That's a statistically insignificant amount. After 30 years, the evidence was finally clear. A lot of the time, that massive fusion surgery just wasn't necessary. So, let's just recap. We have new science that says we probably need less fusion, and we have an amazing new tool that's perfect for doing less invasive surgery. Problem solved, right? Well, this is where the story takes a very familiar and kind of worrying turn. And here is the paradox at the heart of this whole thing. Just as the best science is telling surgeons to maybe back off on fusions, a brand new way of doing fusions is absolutely exploding in popularity. So what's going on? Well, the answer is something called Endo-LIF. It stands for Endoscopic Lumbar Interbody Fusion. And what that means is that surgeons are now using those incredible new endoscopic keyhole tools to perform the very same fusion surgery that big NORDSTEN trial just proved is often unnecessary. To see the real human cost here, let's just look at one case study. A patient gets an endoscopic fusion. And, from the outside, it looks like a huge win. When doctors check later, the back muscles, which are normally all torn up in an open surgery, were perfectly preserved. They were pristine. But on the inside, there was a huge problem. The entire point of the surgery, to get those two bones to grow together into one solid piece, it hadn't worked. All the hardware was in place, but the biology just didn't happen. The fusion had completely failed. And the result for that patient was just devastating. It wasn't relief. It was 20 months of severe, debilitating pain, all from a failed fusion. A fusion that, if you look at the latest science, they might not have even needed in the first place. This brings us to the real core lesson of this whole debate. Because it's not just about backs and bones and screws. It's about the relationship between a surgeon's hands and their mind. So let me be really clear. The endoscopic tools themselves aren't the villain here. This technology is brilliant. The true problem is what it's always been. It's human decision-making. It's about choosing when to use a powerful tool, and maybe even more importantly, when not to. The author proposes this simple but really powerful framework. Before doing any new procedure, a surgeon should ask themselves 3 questions. First, can we do it? That's just about technical skill. But then, more importantly, should we do it? Does this patient actually need this big intervention? And finally, will it last? Is there solid long-term evidence that this is going to work? And this quote, man, it just perfectly sums up the entire argument. The real measure of progress isn't inventing a fancier, smaller way to do a big operation. The real measure of progress is gaining the wisdom to know when the best answer is to do the smallest possible operation, or maybe no operation at all. So we're left with this big question that goes way beyond the operating room. With any powerful new tool, whether it's in medicine or AI or anything else, how do we make sure our own fascination with progress doesn't get in the way of the fundamental goal, which is to serve people's real needs?